Do you feel like you can't breathe sometimes, have heart palpitations, feeling restless, muscle tension, sweating, trembling? If you have any of these things, it's possible that you might have anxiety. Stay tuned for the rest of the video. Let's discuss what is anxiety. So, what is anxiety? According to the DSM-5, anxiety is the anticipation of a future threat. Now, there is normal anxiety versus abnormal anxiety or anxiety disorder. Normal anxiety is if you're taking a test or exam, and the day of you wake up, you feel a little anxious, you feel a little nervous about the exam because you want to know if you're going to pass or fail. Or let's say a job interview. If you have a job interview and you may really need the job, and you may really want the job, and it may change your life if you get the job or not. Well, that can give you some anxiety, but it's normal anxiety. But a person who has anxiety disorder, let's say the job interview was 3 weeks ahead of time that you knew about it, or the test was 3 weeks ahead of time that you knew about it. Well, anxiety disorder, you may have an intense feelings of anxiety for that whole 3 weeks. You might not sleep at night. You may have trembling. You may have trouble eating. You may feel like you can't breathe because there's this intense sense of worry that you're having, or fear about the interview or the test that you're taking. So according to the DSM-5, to be diagnosed with the actual anxiety disorder, you should have those symptoms, those intense feelings for about 6 months. But again, that's just a guide. That doesn't mean that if you having these intense feelings of anxiety or these symptoms, physical symptoms that are like so intense last, for about 3 months, that you may not have the anxiety disorder. So that is what the DSM-5 classifies anxiety. Now, there are different types of anxiety. Now I'm just going to go over the different types of anxiety in a brief description. In later videos, we will go in detail to each one of those different types of anxiety. So the first anxiety disorder that we'll just briefly talk about is separation anxiety disorder. Separation anxiety disorder is when you have this attachment to a significant other, a mother, a daughter, or it could be anybody, and the fear of being away from them too long or being from around them too long gives you this anxiety. That's the first type of anxiety disorder, separation disorder. The second type of anxiety disorder is selective mutism. So selective mutism is being quiet in, let's say, school, for example. In school, if you have to speak in public, you decide that at that moment, you're just not going to speak in front of whomever at school. But this is not something that happens all the time. Like when you're around family, when you're at work, or whatever the case may be, you have no problem speaking. But in this selective situation, let's say school, again, you just choose not to speak, or the anxiety is so intense that you're not speaking in that situation. That's selective mutism. The next anxiety disorder is specific phobia. Now, specific phobia could be anything. A lot of people have a phobia to heights. A lot of people have a phobia to snakes. One in my field as a nurse, there was a lot of phobia to needles. So people will, at the sight of a needle, pass out, or they can turn their head as you're going to give the injection. And then once you give the injection, because they felt the needle, or the worry intense that they knew the needle was going to get, that they pass out as well. That's a specific phobia to needles. It happened all the time. At the testing site where I was just working at, or the vaccine site, a lot of people will pass out all the time. And then people who are in line waiting for the vaccine will think that people are passing out because of the vaccine, but it was really just that fear of needles that was causing people to pass out. And I would have to go explain that to them to keep the people from running away from getting the vaccine. So the phobias can be so intense that they create this intense feeling in your body that causes you to literally pass out. That's specific phobia. The next type of phobia is social anxiety disorder. So social anxiety is when people in certain settings, they feel like their anxiety is so intense that it causes them to stumble over their words. They can't speak, they can't get it out. It happens a lot in teenagers. Sometimes they get this social anxiety from school, having to speak in school, college students too, or just having to speak in general. Anybody, could be a presentation at work. If you have social anxiety disorder, just the thought of having to speak in front of a large crowd gives you so much anxiety that you start trembling, that you start having palpitations, and it happens every time that you're about to speak in front of a large crowd or anything like that. Now, it's not just attributed to large crowds. Social anxiety disorder could be you may not want to eat in front of people because you have this anxiety of thinking you're going to be judged or people are watching how you eat. It affects everybody differently, but just a brief description of this social anxiety disorder. Panic attacks. Now, panic attacks are not specific to anxiety. It could happen from different mental health illnesses, but it's common a lot in anxiety. You have this intense feeling of doom that comes over you because you're worried about something so much, or you have such fear of something that it causes panic in you, that you're literally, all these sensations start coming over your body and you feel like you're gonna die. Like it's real. I've actually experienced a panic attack maybe 4 or 5 times when I was in the height of my anxiety. And I drove myself to the emergency room because I thought that I literally was going to die. It's such an intense feeling that comes all over your body. It usually passes in between 30 seconds to a minute, but the feelings are so intense that you need something or someone around you, or you're gonna just take yourself to the emergency room because it's just that intense. Those symptoms, the physical symptoms that you feel. The next one is agoraphobia. Agoraphobia is a fear of being in certain like open spaces or closed spaces, but the real fear of it all is that if something happens, you won't be able to get out or get away or get help right away in those situations. Claustrophobia is part of like agoraphobia. People are so in, like if you're in an elevator, you're trapped, you feel like you're trapped in the elevator, you start to feel like you can't breathe because it's that you feel like you can't escape. And that's what agoraphobia is. You just feel like there is no way out. The next one is generalized anxiety disorder. Generalized anxiety disorder, or GAD, is just constant worry or fear about all type of things. It could be school, it could be work, it could be your children, it could be anything. It could be a combination of everything, your finances, your bills. If you just have this generalized anxiety about any and everything that worries you, or you fear so many different things, then you probably have generalized anxiety disorder. And the last anxiety disorder is substance-induced or medication-induced anxiety. If you drink too much alcohol, you can start having anxiety. If you withdraw from alcohol, you can start having anxiety. Or certain medications that you're prescribed by your doctors can cause you to start having anxiety. So it's related to a medication or a substance that could be the possible removal of the alcohol or that medication could potentially have your symptoms go away from actually having anxiety, but it's induced by the medication or alcohol or drugs or any, illicit substances like that. So that's just a brief description of anxiety and the different types of anxiety. I will make more videos that go into each one of those anxiety disorders independently because they all have different variables according to the DSM-5 that you need to have in place to actually be diagnosed with those particular disorders. So like, subscribe, turn on your notifications, come back for more. Angel, the Psych MP. Ciao.